about to do a mobilisation technique using one of these mobilisation belts for somebody who's restricted in rotation at the hip joint. Okay, so the way this works is we're going to place the mobilisation belt around the patient's thigh. We're going to get them to position that belt high up in their groin, so it sits as high up on the thigh as comfortably possible. And then we click the belt buckle in position, and that's going to sit around my hips. So in this position here, we can take the leg up. There's no tension on the belt just yet. We get the hip, and the hip and thigh at 90 degrees, and then from there we can assess where that patient's rotational deficit might be. And so for my patient here, its internal rotation is quite restricted, doesn't have a lot of range there. So what I'm going to use here is the belt is to create a lateral distraction component or movement to kind of open up that ball and socket joint. So we've got our ball and socket, the lateral distraction pulls that joint slightly open, creates decompression inside the joint, less compression, more space for that joint to move, and then we can immobilize that joint into rotation at that point. So we leg up in that position. I use my hips, I'm blocking the knee here with my top hand, I use my hips to push backwards slightly, which drags that joint open, creates a little bit more of a loose back position of the joint, opens it up, and then we're going to rotate that hip out into the direction where he has the restriction. There'll be a bit of a capsular stretch at that point. We can bring it back, and then I'll reduce the decompression of my hips again. One more time. Decompress at the hip, pull the belt tight, rotate that hip, bring it back, and decompress. And again, bring it out, rotate, and you can do that 6 to 10 times, and you'll find that the more times you do this, you'll get that a little bit further on each rotation. The patient's still going to feel a nice stretch on it, but the more times you repeat it, the more range you'll start to see happening at that joint. So the key thing here is use the belt to decompress the joint, open it up with that lateral distraction. Once you're in the distracted position, then you rotate, return it to neutral, and then decompress. Okay? And that's how we're going to use movement with mobilisation, using the belt to create a distraction to improve that rotational capability of the hip.